Well, thank you so much for coming here today. We're going to start the sessions in two lots. We've got, they're very brief sessions which are hopefully intended to give you an overview of the current situation with leg ulcers. Not all of you will be familiar with them, and with chronic wounds as a whole, and why we are interested and very committed to launch this manifesto, which we'll explain in more detail. My name is Roland Renyi. For a while, I had the privilege of chairing the Lindsay Leg Club Foundation, and it's a charity, for those of you that don't know, many of you will, that supports people suffering from or at risk of diseases of the lower limb. Some of you MPs who will be here may have a leg club in your constituency, and if you haven't done so already, I would encourage you to visit one. Now, wounds, as most of you know, many of you I see have been involved with them for most of your lives, can be very frightening if you're suffering from, especially if you are elderly and all of a sudden out of the blue you get a leg ulcer and you don't know why it happened or what it's doing or what it's there for. But they can be even more frightening if you're not getting joined up excellent care. And that is the issue that we want to talk about today and highlight today. And I wanted to begin by reading a testimonial by a patient, a lady, about her mother. My 84-year-old mother first developed ulcers last winter. She'd previously been in contact with her GP surgery on several occasions due to red, itchy legs. During a phone appointment, the GP thought it might be cellulitis and prescribed a course of antibiotics. But the symptoms carried on and a number of further diagnoses were made, including eczema. The itching and subsequent scratching led to breaks in the skin, and soon after that, the leg ulcers developed. Initially, just one leg was affected, but she soon developed ulcers on both. She tried hard to remain active, as she always had done. Having had several heart attacks, she knew about the importance of keeping active and exercising. However, the ulcers became so painful that she was eventually unable to walk. Community nurses came out regularly to change the dressings. But this was so painful that she had to be given painkillers. No further treatment or advice was given, although she was contacted by the cardiovascular department at our local hospital to say that she was on the waiting list for an appointment. Over the next couple of months, the ulcers got progressively worse, and by March, she was in excruciating pain. She had gone from being an active and independent lady to somebody who could barely walk unaided. Morphine was prescribed to help with the pain, but this made her dizzy, and she needed someone at home with her. When the pain became even more severe, an NHS 111 GP increased the dose further, which led to her being admitted to hospital with delirium. Thankfully, one of her sons was staying with her at the time, and it was only when she was admitted to hospital that she started to get the treatment that she needed. She hadn't been referred to a tissue viability nurse while in the community, which normally would have happened within 2 weeks of her ulcers being diagnosed. We were very lucky to have been able to call on the expertise of Ellie Lindsay and her team, who kindly advised us what treatment she should be getting and what tests to push for, and referred us to a vascular consultant, Dr. Luke Labiasi, who happens to be here with us. The consultant kindly gave us reassurance, advice, and palliative support. Not every family has this level of expertise and support. However, it was too late. The combination of the delirium and the ulcers left her too weak. She died of sepsis on May the 18th, 2022. As a family carer, it's extremely distressing to witness somebody who, before the onset of the ulcers, was independent, sociable, and active, suddenly deteriorate into somebody who is frail and no longer safe to live alone. Without an expert knowledge of healthcare, you can only trust the system and assume that they are getting the right care. Well, that's one experience, and of course there's fantastic treatment for leg ulcers and chronic wounds in several parts of the country. East London, I know, has fantastic facilities, but it is a lottery depending on where you get the illness and where you get the disease. So some of these factors often come into play. Uncommitted treatment handed out, given by unconnected clinicians on an ad hoc basis without follow-up. rushed and undertrained district nurses visiting patients in their homes, application of dressings without really understanding what they do and, more importantly, in what context they should be applied, poor and at best haphazard treatment of patients, bordering sometimes on the inconsiderate or neglectful. Well, so what we're saying to that really is enough is enough. This has got to stop, hence our manifesto. We've got a manifesto for change. Everybody should have an equal opportunity to get the full range of care that we have available for diseases of the lower limb and chronic wounds generally. Diseases which, as we'll find out, are much more prevalent than we might think. And to do that, we need to educate, we need to advocate, and we need to speak to you, and we need to speak to our MPs. So that's really the introduction, and I hope you really enjoy the following talks, which are given by our country's principal experts in the field. But before we go to that, I'm delighted to introduce you to our host, Derek Thomas, who is just please come through. Thank you very much, Derek.